Welcome to the Tapestry of Life on CCP-TV, the Emmy-nominated educational channel of Community College of Philadelphia. I am Dr. Pascal Scholes, Professor of Behavioral Health and Human Services. Today's topic is trauma and peer support. Trauma occurs when an external threat overwhelms a person's coping resources. It can result in specific signs of psychological or emotional distress, or it can affect many aspects of a person's life over a period of time. More than 90% of persons served by behavioral health organizations have a history of trauma which can affect their ability to form relationships, keep a job, or live in stable housing. We can't offer enough effective health care to improve these outcomes. Today's informed peer specialists are a new integral part of most progressive healthcare organizations. To discuss the topic today, I want to welcome my co-host, Anzi Travis, from the Institute of Recovery and Community Integration from the Mental Health Association of Southeastern Pennsylvania, and my two very special guests, Evan Figueroa Vargas, who is a lead recovery coach, peer navigator at the Mental Health Association of Southeastern Pennsylvania. He is a trauma survivor and a graduate of Community College of Philadelphia. And Joan Wildhaus, a trauma survivor and a mental health worker at JFK. That wasn't so bad start. We got a good introduction. I want to mention just a couple little things. I know Anzi and Evan are both graduates of Community College of Philadelphia, so that's it's always nice to see graduates
Absolutely.
come back.
And it was a great experience here. And I moved on to St. Joseph from here.
Great.
Absolutely.
Why don't you tell me a little bit? We've done a couple shows on trauma, and this whole trauma-informed care and the whole issue of the impact trauma has on one's life. Now, normally, what I understand is that the peer specialists, usually where they are the peer specialists is because there's been trauma in their life, and they can then take that trauma and relate it to working with other people in a kind of the old model I used to call the recovery model, kind of where you're kind of a peer support person with some background in behavioral health or mental health and addiction. So I was wondering maybe someone could start with, give us a little history of the trauma that you experienced. We all have trauma, including myself, and including, Anzi will talk about some of his experiences also.
Okay, well, first of all, just say what a certified peer specialist is. To qualify to become a certified peer specialist, a person has to self-identify as having had a mental health co-occurring disorder and have successfully living with it. Also have to be an high school graduate or GED and have at least 1 year of work experience, and it doesn't have to be consecutive, and have a resume. And those are the criteria that's set by OMSAS, the Office of Mental Health Service Association.
Okay, so certified peer specialists can, I know that all of you are from the mental health side of the equation, and there are co-occurring disorders. Generally co-occurring, for the audience who might not know about it, is really addiction and mental health.
Absolutely.
Most of your exposure that brought you into the field came from general psychiatric or mental health issues, or mental health challenges, as we like to call it today.
Absolutely. If I can self-disclose, I was actually diagnosed with a bipolar disorder back in, I would say, 2009, when I was incarcerated up on State Road in the Philadelphia prison system. And that's when I first realized that I was had a mental health challenge. Like I said, they diagnosed me with bipolar disorder, and they also diagnosed me with depression, which I've challenged to this day, because I was pretty depressed because I was in jail. I didn't want to be in jail, so I'm pretty sure that made me depressed. But sure enough, when I came home, they put me on some medications, and they referred me out to some psychiatric places for me to go to. I didn't quite agree with the medication they put me on. They put me on quite a few medications. most of which kind of dragged me down and kind of kept me down.
Well, usually bipolar, it's kind of got this, bipolar means up and down, you kind of go
Absolutely.
like this, and sometimes the medications are to do this,
Yep.
kind of stabilize you. But I will admit to you that some of the bipolar is the old manic depressive, in the old DSM-3 and 4, I guess. And when we do talk with people who have bipolar, they don't like the medication because it kind of changes
Yep.
the way they feel, and they don't like the change. I don't know if that's the experience you have.
Absolutely. That is totally an experience for me, to the point where I haven't taken medication in maybe the last 4 to 5 years. I just kind of been off of medication. And that's where peer support has really played the role with me. Just, staying busy, doing positive things, just being around others that kind of can relate to what I'm going through, both with my mental health challenges and also my substance abuse challenges. That's what really helps me out versus taking medication, kind of feeling dragged down.
So in your case, at least around this initial diagnosis, you personally felt that when you came off the medication, what kept you off the medication was the fact that there was a support network, what we're calling peer specialist network.
Absolutely.
Do you know anything about where the depression or why you were feeling that way, and historically were there any other traumas that you might relate to that could attribute that? Because if you got over the trauma, then there's no need for the medication.
Yeah. So absolutely. I mean, when you look back at my childhood, I had a pretty rough childhood. Wow. I grew up in North Philadelphia, pretty much drug-infested neighborhood. It was pretty bad to the point where I grew up in a house where someone was using crack cocaine. As a result, actually in 2002, my brother died as a drug overdose, as a result of a drug overdose. He lost his battle to crack cocaine on New Year's. He actually overdosed on New Year's Day. So that was a pretty traumatic experience. But if you fast forward to say around 2005, losing my immediate family, and what I mean by that is the person who I was with at the time, and actually not only losing her, but also losing my child, that must have been the overwhelming traumatic experience for me. I mean, that's got to be the biggest traumatic experience that I've ever experienced in my life, going from a household where you come home to, your other half, your spouse, and then you come home to a kid that's in his toddler stages, daddy, when you come in from the door from work, to actually losing that person, losing the child, and then losing that side of the family also. Not only did I lose them, but then I also lost that side of the family, because as soon as they left, I immediately became the bad person. So that was a really, really dramatic experience. And then throughout that time, I was almost kind of given a gift and a curse, because I was involved in a motorcycle accident. And as a result of that, through physical therapy, they also put me on prescription painkillers, oxycodone, Percocets in my case. But what I found out pretty quickly was that taking this pain medication not only numbed the physical pain, but it also numbed the emotional pain. So no longer did I kind of think about that person, that individual. I can cope with the fact that my son wasn't around in my life, and I can care less if the other side of the family was talking to me or not.
When we interacted some time ago, and you was telling me about a trauma that happened in your early childhood, you think you could share that with us today?
Absolutely. And thank you for that, honestly. Even going back into my early childhood, I was sexually abused by a family member as a youth, and
You mean like 12 or 13?
I was actually 7.
Oh, 7.
And was really interesting about being a 7-year-old being sexually abused is that I can vividly remember every detail of it. And what I remember the most about it was when I was informed by the predator, in my case, was don't tell nobody or you're gonna be beat or you're gonna get in trouble. And sure enough, I lived with that for years. I mean, when I tell you that I was on State Road, it was then, because I thought I was going to be going away for a very long time. So I just wanted to, just clear the air with my parents and just kind of tell them, kind of the things that led me down this path to where I was at. And one of the things that I told him was, you know, this is what happened to me as a youth.
And how did that make you feel growing up, you know, in your up to your adolescent years?
It made me feel pretty bad, man. And I tell you what, it almost was my worldview of the world or my environment was that this world is an unsafe place. And especially when you talk about family, which is there to nourish you and kind of protect you, and then I have a family member that's caused me this trauma. You know what I mean? I grew up and to this day, Pat, I look at the world as this world is an unsafe place.
Even today.
Even today.
So even though you've managed the trauma obviously pretty effectively,
Yes.
you know, over time, it still stays with you, which I think is true for all trauma. Something in the environment can trigger. It's almost like a post-traumatic stress kind of situation. Would you say?
Absolutely, and then I would also add that even though I've learned to actually cope with the trauma on my own, I have never been given the opportunity, or nor do I think I've taken the time out to address my predator, the person who harmed me as a youth. Nor did I ever take the time out to talk to my old spouse, you know what I mean, or my child, and say, you know, how did things work out this way? What happened here? So I just kind of learned how to kind of cope with things on my own.
Oh, you did? How did you cope with it? Because if I went through that experience, I personally, I mean, at least thinking back on your experience, I don't know how I would survive it. I guess you deny it and you live for a while and things happen. If you look at just the therapeutic way in which people deal with trauma, it can occupy a lot of your thinking, especially when you're alone, especially when you're laying down in bed and thinking, and you know, because your whole life goes, you know, past you.
Absolutely.
Yeah, you think so?
As a trainer, and you know, one of the things we do in the certified peer specialist training is we have people tell their recovery stories, and actually, you know, the literature said 90%. I think it is even higher that trauma precipitates mental illness and substance abuse problems. And during the course of the training, we had to change from doing our stories on one day into spreading it out because it was just too much trauma
Too much to
for
handle.
the participants to handle in one day.
Yeah. Does that make sense to you?
Yeah, absolutely. And just going back to peer support, earlier on, one of my biggest supporters, and to this day has been Ozzy, and so has Joan. I mean, earlier on in my career, and you know, coming home from being incarcerated, you didn't know where to turn or what to do. And just sharing some of these experiences with someone who wasn't laughing at me, wasn't judging me, you know what I mean, and only wanted to see me go in the right direction. That was the type of support that I needed. And then also I was able to relate with Joan. Joan had just come home from prison, from doing time. Joan knew what it felt like to lose a family member. She knew what it was to be on substance abuse, mental health, things like that. So just being around these guys, you know, at organizations such as the Philadelphia Recovery Organization, Achieving Community Together, PROACT, up on 1701 West Lehigh. Just being part of these trainings where Ozzy is mentioning, you have a wonderful woman by the name of Jasmine Banks from the Department of Behavioral Health. She's also trauma informed. She does a lot around family inclusion. So just kind of being around those folks, and also being involved in the Behavioral Health and Human Services program here at the Community College in Philadelphia. I have to say has been one of the most therapeutic things that I've ever experienced in my life. I mean, to this day, I don't consider what I did here as work. I was having a blast the 2 years that I was here. And then the professors, you being one of them, you have Dr. Hickman and Kerry Arnold. Those professors were amazing at, you know, taking the time out to allow me to express myself and share some of my concerns, and just giving me that feedback and that reassurance that, you know, sure, those things happened in the past, but you know, you have a future and you can move forward from here. It doesn't end here.
You know, it's kind of interesting. With you're familiar with Freud, Adler, and Jung. And we talk about Jung. I talk about Jung often, and it's almost like healing has to do with just humanizing shadow experiences that you don't really want to talk
Those
about,
that-
and you think that everyone doesn't have them.
Right.
But everyone does have them. And once you're able to meet people who have them and realize that you need to talk to them, they don't become as frightening to you. And sometimes in this culture, the problem with Western culture is that when a push comes to a shove, they medicate. Now, I'm not arguing the need for medication. I'm sure,
It has its
I don't want to
place.
get a lot of letters and notices and emails about, medication. I know medication is important,
Absolutely.
but I suspect in this culture, it's like a simple overkill. We tend to overdo it.
One thing about medicine, recovery is human work. Person got to do the work. The medicine can help, but a person has to do that work.
Yes, that's true.
Absolutely.
And I know you mentioned Western culture, but when you look at the Latino culture, it's taboo to talk about your mental health challenges.
Yeah.
And where I mustered up the courage to kind of start coming out and disclosing like, hey, I have this mental health challenge, and sure I struggle with these things. And sure enough, I found out that I was not the only one. My mother has been part of the same psychiatric services for the last 25 years. I didn't know anything about that. When in talks with my father, he's had the same therapist for the last 20 years.
Mm-hmm.
I didn't know anything about that either. So you just kind of like, self-disclosing, and then when you self-disclose, you pretty much find out that, hey, I'm not the only person that's struggling with these things. There's other people, man. Jonah's out here. She has similar experiences. It may not be the same ones, but they're similar,
And
absolutely.
Disclosing is important. That's the only way we can fight stigma is people have to disclose.
I'm probably I'm one of the older guys sitting on this table right now, I think. And when I hear your stories, it reminds me of the old traditional AA or NA when we used to go to meetings and people would disclose and hear the stories. The thing that's different about it is that it's taken it out of the meeting, and I still love the meetings. I'm not arguing that, but it's taken it out of the meeting and put it in the community more than it historically has been. In other words, there's all kind of support services like PROACT, et cetera, that seem to be quite helpful. Joan, I was wondering, does your story, I know, sounds similar.
Yeah, it's a little different. My family, we don't ever talk about it, but my mother was an alcoholic when I was growing up, so she was never around. My birthday parties as a little kid, they always had to be canceled. My father and I would go stay in a motel to get away from her, And, I can remember like one instance was she was driving my dad's car and she was swearing at him and she said, "I'm going to wreck your car." And my dad and I came up the road and there was the car upside down in a ditch with all the fire company there. And my brother was a volunteer fireman, so he had to deal with this. But we don't ever talk about that. That's the family's little hush-hush thing. We don't discuss it. But when, and then instead of choosing alcohol, I chose drugs. And I was a single mother. I got involved with a outlaw motorcycle gang,
Oh, okay.
which I tell people that now today, and they look at me, they go, "Huh?" So, part of my thing with the peer specialist training was we had to do a little poem about our story, and I said, well, from bikers and gangs to handcuffs and chains. My addiction led me to selling drugs, and I ended up going upstate for 4.5 years. It was supposed to be for a year. I'm also a domestic violence survivor, which goes along with the population of the biker club. I've been thrown off the back of a motorcycle. I've been beaten, bloody. I've been raped. I've been, by my spouse, and it's a lot. It's a lot to take in. So, and we don't ever talk about the addiction. All I ever heard from my family was, "Well, no, there's nothing wrong with you but you."
Mm-hmm.
They don't believe in that addiction is a disease. I made bad choices. That's it. That's all. So while I was in the inpatient TC program upstate, my mother and father
Therapeutic
died.
community.
Therapeutic community, yes. It was called The Journey to Freedom. And it's a 4-month program, which now they've knocked the TC programs down to 60 days upstate because of the overpopulation. Anyway, my parents died 15 days apart. My mother first,
While
and
you were
then
incarcerated?
while I was in the program, waiting to come home with a bed date to be released that December. And in May of 2010, my mother died on the 15th, and then my father died on the 28th of May. And I got no family support. They blamed me because I was in jail. I had a breakdown. And of course, when you're incarcerated, you don't get help for that. They kicked me out of the program because my behavior changed.
Yeah. What kind of a breakdown did you have?
And I had a mental breakdown, and they just put me on medication, kicked me out of the
Were
program,
you
and said,
suicidal or?
no, I just couldn't cope. I didn't want to get out of bed. I just couldn't cope.
all
I did nothing but
You
cry.
didn't bathe. You didn't.
I just didn't want to cope.
Right.
And they said, look, that happened on last week. Why are you still upset about it? Everybody got problems at home. Now, the director of that program, his mother died. He got 2 weeks off of work.
Yeah. Well, you didn't.
I
out.
couldn't get 2 hours off from the program. They told me not to talk about it, that everybody had problems at home, and that was that.
So that's the health services in that
Yeah,
prison.
so that's how you, that's the, yeah. So, you know, and it's funny, and they say that, you know, people get put in your past for a reason. My cousin, who was my co-defendant, she was brought back to Muncie as a parole violator. And it was her that kind of snapped me out of it. And she said, oh, no, we're not acting like this. Now, come on. So, and, you know, so then we kind of clung to each other. And I ended up, parole slapped me with an 18-month violation. So I ended up doing 4 years up there instead of the year I was supposed to be up there. Until you get a release date and then a bed date and blah, blah, blah. So I came home. Now, I'm a girl. Anzi loves this part of my story. I'm from Lancaster County. I was living in Lancaster County before I went to jail. My neighbors were cows. I rented from the Amish people, okay? Department of Corrections dumps me off in the middle of North Philly.
Oh.
Oh,
Culture
yeah.
shock, huh?
Yeah, they
Not many
hand-
cows there.
Yeah, no, not at Gaudenzio on Henry Avenue.
No.
they gave me 2 tokens, and the counselor says, figure it out. I said, well, what are these? What am I doing with these?
So that was your aftercare plan.
I
quote,
never heard
your
of
aftercare
SEPTA. I never heard of SEPTA. I'm like, what is SEPTA? You know, because we lived on the motorcycle. We took it even in 20-degree weather. We were on the motorcycle. So, you know, so I got in contact with the educational person over there, Miss June Sorrell, and she's wonderful. I actually was over there yesterday, and she hooked me up with ProAct. So the first person I met over there, I went over there and I met this big 6'5" bald black guy, Mr. Lester DeLoach.
Yes.
And he says, come on in here, you're one of us now. And that was all it took. And I started taking the trainings for the recovery specialist. Well, then I found out if you became a volunteer, you didn't have to pay for the trainings.
Mm-hmm.
So I had an ulterior motive at the time, but little did I know I would enjoy it. So, and I met Evan. Evan and I took the volunteer training together for ProAct. And that's how I met Evan.
Yeah, you know,
So-
for the audience and for your thoughts too, we did a show on ProAct.
Right.
Fred Martin was the
Yes.
co-host of that show. And so if anyone's listening and wanted to go back and look up that show, it's there. And they do wonderful work. Beverly
Amazing
Harrell, the
work.
whole group there is just doing great work.
This is where I met both of them, and my first mental health first aid training, they were in that class with me and Mary Harper back in 2012.
Wow.
And Joan needed a place to live. She couldn't get out the halfway house. And Sean asked me to hook her up with a place, and I hooked up with the program, Recovery House, so that she could leave the halfway house she was in. And I'm proud of both of you. You're really doing great, and I hope you continue to do so.
Anzi and Evan have both been, talk about peer support, and these guys, they are just the
So you
poster
were
child of
You were in the
peer
women's
support.
correctional facility called Muncie, which
Yes,
is the
Department of Corrections.
That's where
And-
you have to do at least 11 and a half to get there, months.
Right. I was
or
actually
more.
stuck in the county for a year because they lost the evidence in my case.
Oh, okay.
So they kept postponing, and then they,
And
You
didn't
know.
they didn't have any kind of services?
well, this is funny. They sentenced me to go to SCI Chester, which is an all-men's facility, to do a 6-month program and go home.
Oh.
So you can't send a woman to SCI Chester, but that's what my sentence was, and I could do this 6-month program and go home. But once you're property of Department of Corrections, it's up to them. You do what they tell you to do.
Sure.
It doesn't matter what your judge said. Your judge has nothing, his piece is out of it once you're part of that.
Well,
So,
that's actually why Michelle Alexander's work on Jim Crow, that you're enslaved.
Right.
That's basically the
and,
theme of
and
her
I
book.
don't think that there's enough reentry services out there to help people reintegrate. Like I kind of had to find my way, and I met Evan, I met Anzi, I met all the wonderful people at the Philadelphia Recovery Community Center, and like now looking back, like as far as Gaudenzia goes, I'm on a steering committee with the Center for Substance Abuse and Treatment for reentry services with the Department of Corrections and the State Parole Board. And I was over there yesterday, and to me, that's just like, wow, me?
Well, the whole concept of reentry is becoming quite popular. We have a whole unit right now here at the college on reentry programs, helping people make the transition and get into a program, and in particular, one of the programs at the college. So there is a certain sensitivity to that, and I think the president is pretty sensitive to that. The president of the United States
Yes.
I
is pretty
agree.
sensitive to that.
I agree. I have several people who, when I was a counselor, you know, came through that program. Some have graduated, some are still there, are still here rather.
You know, it's astonishing to me always, every time, you know, when we do the show, there's an awful lot of people who have had, went away to college, called prison sometimes, as they refer
I call
to
it my vacation at
Your
the spa.
vacation at the spa. And what is always startling to me, I've yet to hear someone, and I agree that it's a narrow, skewed population that I deal with on this show. I've rarely heard anyone talk about the tremendous amount of therapeutic services that they received while they were in the correctional
The
facilities.
therapeutic community, at least for me when I was there, I can only speak on myself, was a joke.
They did have meetings, though, right? I think they had
No.
meetings, didn't they?
No,
No,
they would have what they would call an NA meeting, but you had to be, there was only 12 people from each unit allowed to go.
Oh, so it was a
It was that
restricted.
could be, it was a restricted group, which really doesn't hold true to the values of NA,
No, it doesn't.
you know? But, and then I was forced to go to meetings through the recovery house where I was, and everybody seemed to me like they were angry at those meetings. My recovery was, you know, like, but I'm part of a thing called I Am Not Anonymous, where we go, we posted our story online and with our picture. Tom Goris and Kate Meyer, they run that, and that was really, to me, that was just such an eye-opener. And it's this was like 2 years ago that we did this, and you know, then we have Unite to Face Addiction, and I'm part of that, and it's just, I think the more we talk about our experiences and the more we talk about the things, more people are willing to open up. Like, to me, like I said, I never talked about the way I grew up, or the things that happened when I grew up. And then I meet all these fine people in Philadelphia, and it's like, oh no, you've got to talk about this. You've got to share this, you know? And I can relate, and you're not the only one. So yes, talk about it.
Well, I think that's a fairly new phenomenon, even in the city. I
Yes.
mean, that's I partly attribute that to Dr. Evans' work.
Absolutely.
In the sense of, because historically, the fellowship, as we refer to it, you never told anyone you were even a member of it. And when you ran into people that were not in your group, so to speak, you just said, hey, hi. How do you know that person? Oh, I just know him from around. And that has shifted dramatically
Right.
in the sense of people almost self-identifying. You know, the recovery walk, which is something that it's
I'm on the planning committee for that.
yeah, a wonderful experience that we have. But I wanted to ask a second now. So you had, how would you identify, if you had to look back, what were the 3 or 4 traumas that you had that were significant that you had to work on in order to move yourself forward?
Growing up with an alcoholic parent,
A good trauma.
probably my addiction that led me to be
Okay,
incarcerated,
another trauma.
and then my parents dying.
Yeah. And probably being incarcerated is
Yeah.
pretty traumatic
Well,
too.
yeah, that was very traumatic.
Absolutely.
And would you say that the reason why you're healing today is what? What did you do
Because of
to
the
heal?
people that I've been able to share my things with, the
Oh,
peer support
okay.
that I received once I came home. Once I came home, I received such tremendous support. And I didn't even know that things like that were available until I got to Philadelphia. And I think Philadelphia, we're leading the nation in
Tip of the spear.
recovery support, because recovery is not just drugs and alcohol.
Yeah.
You know, and it's just, and now I work as a mental health worker, and you know, I tried for a long time to get into peer specialist training, and I kept getting denied. Evan Onzi wiped a lot of tears off that for me. And then I finally got in, and I took that training, and then I was hired. I was actually hired for my job while still on state parole, which to me was like, wow, you know. And then I worked for a couple months as part-time, and then my supervisor came to me one day, and she said, I want to hire you full-time, but you're going to change. We're going to take all your credentials, because I'm a forensic peer specialist and a mental health first aid instructor and a RAP facilitator. If you don't know what RAP is, Wellness Recovery Action Plan by Mary Ellen Copeland.
Yes.
And they rolled them all into one and made me a mental health worker. So I've been at JFK for 3 years now, and I shared a little bit of my story in our orientation group. And sometimes, you know, when they come up for orientation, they need something to cling on to. And as soon as they hear, I have a forensic background, or and they look up and they go, oh, wow, can I have an appointment with you when we're done?
Sure.
So, you know, I do a lot of case management stuff, and people listen. And when you put a smile on someone's face because you're able to relate with them, that
Makes a
just
lot of
makes the whole
difference.
day, you know?
So part of your trauma recovery, if we want to use that word, I don't know if there's such a word, but if we use it, is actually doing the work that you do.
Yes.
And I would say that's the same. I think it's the same for all of us, actually.
Absolutely. Professor Salazar, among others, have done some great research showing the benefits of working as a certified peer specialist.
Yeah.
There's a lot of places that you say certified peer specialist, and they go, what is that?
Well,
But
it's a
it's-
relatively new
Yes.
field. I mean, if you think about it, I think maybe 5 or 6 years ago, we started giving college credit for that certification. I mean, I think it was like 6 college credits, so that we can get you really in, because, you know, education can be a very dangerous thing in the sense of being successful. So we want to get people into the college as much as we can, and we were giving actually some college credits out for that. But the whole expectation was to build on your recovery and to see recovery as trauma healing, which I think you two, all of us kind of demonstrate a little bit. The problem with trauma is that if you don't reposition it in your brain, you never kind of put it in perspective. It's almost like you have to take it and put it on a mantle somewhere so you could look at it, you see, and say, yeah, I'm a trauma survivor, but I can't constantly look at my trauma. I have to move past that into really the spaces
You have to
all in.
reprogram the way you think about yourself, too.
Yeah.
Because
Yeah.
Because when you looking at it from a deficit viewpoint rather than a strength, you know, just that, it's enough to drag you down.
Yes.
You know, when you're doing it from a strength base, you're doing something positive, you're reinforcing, you're being successful, and that you can build on that.
I'm glad you guys are touching on this topic, because not only did I experience trauma, of course, as a child, and then in my adolescent years, and of course as an adult, but when you look back and you rewind back, I would say the last 3 to 4 years, it was pretty traumatic for me then too. And a lot of people say, well, nothing has really gone on. You know, what could be traumatic about that? But I had to mourn. And then people say, well, who died? Well, the person that I used to be
That's
died.
right. Oh, yeah.
And that was extremely traumatic for me. Talk about learning how to rewire your brain and change the way you think. You know, change those behaviors that you had. That can be traumatic in itself. And you do have to have that recovery, and you know, and know that you can overcome trauma sitting on that mantle. Because guess what, Pat? When I come back around my family, at times they said, well, hey, do you remember when you used to, or do you remember when you used to, or you remember this and you remember that? So they continue to relive it.
Yes.
Continue to relive it. Continue to relive it. So it's really good that I work at the Mental Health Association of Southeastern Pennsylvania, because instead of going to the 11th floor where I work, I can stop on the 10th floor and say, hey, Anzi, guess what happened over dinner last night, man? And Anzi knows. Anzi has had to stop what he's doing and be like, hey, Anzi, like, they just won't get over this part of my life, or can you believe they actually brought this up again last night? Yeah. And Anzi said, well, you know, it's my mentor, man. I trust him and I look up to him. So say, well, you know, have you tried this? Did you consider that? Well, are they trying to cope with it? You know, so that's the peer support right there.
Yeah, and in reality, the way you're talking, you're a trauma to them.
Absolutely.
You turn it around, they see you and they see trauma.
Absolutely.
You know, interestingly enough, because of all the history that you have with them.
Oh man, absolutely. And you know what? I just want to just say thank you so much to my wife, Darlene, because not one person has dealt with so much and has done so much for me. And I think she even changed her education just to be able to understand me more. In the beginning, she was doing a master's in education, and she changed it over to forensic psychology, just to be able to understand, you know, my forensic background and where I'm at now. And I remember in her studies, she used to bolt out of the office and come over there like, I think I finally figured you out. I know what's wrong with you. So she used to like diagnose me. I used to be like, no, babe, like relax. Let's talk about that. But yeah, that's interesting. I think the peer support for me starts at home with her. You know what I mean? Having somebody at home that understands me and is willing to sit down and listen to me. You know what I mean? That's kind of like a good way to start the day. And then, you know, I move on to Ozzy, and then I move on to my team or you know, my peer, my supervisor, and whoever I need to, you know, to make it through another day.
Well, it makes a lot of sense, actually. So if you're creating trauma for other people, if we can follow this model for a moment, what would you do to help them to be less traumatized around you? If you continue to be a stable, effective person who has a new work ethic, and you're in school, which you are, over time, one would expect that although the trauma never really will disappear, because every once in a while they figure you're going to wake up and be like a junkie again or something, because it never really leaves their psyche, just like it never really leaves ours. I mean, what we do is we just manage it better. Yeah. So I guess living the right lifestyle.
Absolutely.
And I guess talking differently to them, right?
Absolutely.
Would you think? I mean, they're two.
Absolutely, Pat. Just you know, doing what you set out that you was gonna do, right? Like, you know, achieving some of those goals. So I set out that, you know, when I came home, I needed a GED, and I told people I would get a GED, and they kind of laughed at me. You know, sure enough, I went and got that GED. Hey, I want to go to community college. They laughed at me again. I graduated at community college with highest honors. You know what I mean? Hey, I'm gonna go work on my bachelor's. You know, people were still skeptical, and sure enough, you know, I'm at Eastern University working on my bachelor's degree now. You know, we're gonna get married. We got married. We're going to purchase a home. We're going to purchase a home. You know, you got to keep working at it, because it's going to take a while for people to really say like, hey, I think he's being sincere about what he's saying, because, you know, those negative behaviors, I was doing that for quite some time. Yeah. It took a while. So I'm sure it's going to take a while for them to kind of reprogram their head and kind of think, you know, my mother still asks me like, you know, what was you doing last night? You was out at 10 o'clock. Was everything okay? I'm like,
still, yeah, it's still like, traumatizing.
I'm like, you know, I kind of was working overtime. I'm allowed to. I'm allowed to be out past 8 o'clock at night. But she still answers those questions, because I'm sure.
Well, you're still her son.
Yeah, well, that too. But I'm sure that at times she's still traumatized from the things that I put her through. Right. And I'll tell you what, Pat, talking about trauma, and here's an experience that my wife and I had a child last Tuesday. I called my mother up at 3:01 in the morning, which was the exact time that my son was born. I heard my mother crying on the other side of the phone for the first time in my life at that time of night for something positive. Because in the past, I would be calling my mother at 3 o'clock in the morning from the roundhouse. Yeah. I'll be calling my mother from CFCF. She would hear the computer. This was a straight connect phone call. Hey, you have a new grandson. And she was shooken up, and she was crying, and she was hysterical. But it was a good thing. You know what I mean? There was a new life coming. It was a celebration. Sure. Time, but it kind of made me reflect back of how far I've gone in my recovery process and how much trauma I've caused them.
And I'm going to tell you something. I don't know your mother, but I'll guarantee you, when that phone rang and she picked it up,
at first
there was a little like, uh-oh, and she heard your voice first, and she probably said, oh my God, here it goes again.
I totally agree.
Mean, that's what trauma does. That's what it does.
Absolutely. Yeah. But it was good. It was good news. And, you know, I was happy to share the good news, and you know, and we'll continue to try to achieve, you know, bigger and greater things. And you know, life is good, man. I'm pretty happy with my recovery, man. Like, I mean, you gotta kind of like tell me to stop talking about recovery, because I mean, we live this thing. We do this every day. I mean, on the weekends, Saturdays, Sundays, I'm supporting people, you know, at church or in the community. Like, this doesn't stop when I punch out at 5 o'clock. I continue to live this 24/7. There's no going back for me. Like, going back to the old lifestyle, to the person who I was in the past, that's not an option for me.
Let me ask both of you, in terms of the people you provide and support, what kind of trauma are you hearing from those people?
A lot of the people that I meet with, I have torture survivors.
Torture survivors?
Torture survivors, yes.
Really?
And it's very hard to get that person to come into the office because she doesn't want to go outside.
Right.
When you say torture, you mean they were... Like,
they were tortured as a child, they were in foster care, and they were literally tortured.
Tortured?
Tortured, yes. I have people that have been, out there using drugs, and they've had things happen to them out there, and they need help with getting past that and being able to look for positive. I had a woman yesterday who was just crying. She came to see the doctor. She's never been assigned a therapist, so we try to help pair them up with a therapist as well as medication so that they can get the best care. So I met with her for a while, and when she got up to leave, she says, I just love you, she said, because I didn't realize what blessings I have in my life. I was too focused on what was going wrong to see past that, to see my blessings.
Yeah, that's what Anzi
So,
was referring to.
so
as
that,
safe space.
like that makes it so worthwhile. Or when you have someone who struggles with their mental health, like, I know the therapists get sick of me because we have electronic records, and I'm always putting messages up. Please call person the day before or day of appointment and remind them, because like they have traumatic brain injuries. I had a person I dealt with for 3 hours the other day who had been discharged from our program and had to get back in, but she trusted me, so I took the initiative and worked with her all day to get her back in through her assessment and get her back up being seen. So, they look for us to help them, and when you can help them and they realize that they're not stupid, there's nothing wrong with what they've been through, that there's nothing wrong with them because they've been through that.
It's what happened
I
to
think
them.
it's what happened to them, yes, and I think like I said for myself, it took a long time for me to realize I'm not worthless.
Mm-hmm.
I'm not all those nasty names I used to be called. I am somebody, and there are people that want to talk to me and they want to help me. And, because you get that mentality where you just don't, you are afraid of the labels that are placed on you. You're afraid of what people are going to say to you or how they're going to respond. And so now I try to be that help that I received.
Mm-hmm.
And I think that, and now there's people that'll come to security downstairs and they don't have a scheduled appointment, but they'll call up and they'll say, well, so-and-so. I say, okay, I'll be right down. And I go down and I get them and I bring them up. And, at the community mental health center, we have to help the people as they come through the doors, because we can't, who wants to turn them away? Absolutely. Right? And most of what I've learned by the people that were there for me. So I try to give that back to the people I meet with.
I've often thought, when I was trained professionally and was a therapist and
Right.
all those interesting things, everything that you're doing now were like almost the things that we were told not to do in our training. In other words, don't you go out there and say hello and hug people and bring them back and ask them, how life is, and can I help you with your welfare? Can I help you with housing? All of these things were almost trained out of us to become like professional kind of counselors or therapists. And over the last 10 or so years, there's almost, instead of retraining professionals, which I hope they would do more of, the whole peer specialist movement fills the gap. So one would hope that as peer specialists move along and get increasingly more advanced degrees for some of you, that you will then have more of an influence on the professional schools like psychology, social work, nursing. Nurses kind of do a lot more of it because they're hands-on more than most people are. And it's almost like not what you were originally told to do. Now, maybe the schools have changed because I've been out of school for quite a while.
Well, no, they haven't changed that much. But again, professionals, they have a distant relationship. A certified peer specialist, they learn a person from the inside out. And so it's a whole different experience. That's why the connection is so much quicker as a certified peer specialist than as another type of professional.
The lived experience is what makes us.
Absolutely.
And for some, I don't want to call them patients or clients because that's not the right terminology, but the
Some
participants-
consumers of service.
Consumers of service. For them, it's a whole new concept when someone says to them, well, what's going on with you? How can I help you with that today?
Right.
That's such new, they've never heard that. They've always been told, take your medication, keep this appointment, and that's it.
Yeah.
That's what you need to do. They're not told, okay, go talk to this person because you're going to be surprised what she might have to say or what he may have to say.
So here's the point I think of. So let's say I'm in an agency and I'm running a group, which I've done many times. I never had a certified peer at the time. Now I haven't been running groups for many years. I think before the movement even got started. In today's constellation of group counseling, group therapy, or certified peer counseling, whatever you call it, is it common for there to be a mix of peer specialists and professionals running groups or doing evaluations and then setting in what we call now today a recovery plan as opposed to a treatment plan? The treatment plan obviously connects to the medical model. The recovery plan connects to resilience and transformative challenges that we now have become quite familiar with. And I'm wondering, did that get integrated into where you're all working now?
Where I am, yes. Our orientation group, we have one group that after they complete the intake process, which is a intake assessment with the therapist and a psych eval with the doctor, they come up on our floor. But before they can get another doctor's appointment or assign a therapist, they have to participate in orientation. So we've changed it from where it's just me running this group, that the supervisor is in there and one or two of the therapists are in there. So they're being welcomed, they're meeting someone, they're leaving there with a doctor's appointment, with an assigned therapist. They feel like someone cares, like it's not just, okay, but now there are ones that they cannot participate in the group for whatever reason, they can't sit in a group. And so I do one-on-one orientations with them and just go over what happens on our floor. And when I first started working there, my work was just a handwritten note, blah blah blah. Now
You're more
I'm
like a
doing
secretarial,
now I'm doing
Now.
administrative case management services.
Okay.
That's what they call it, and it's billable time for them, because the city Philadelphia is recognizing that peer support is becoming a big thing, and they're releasing more funds slowly. It's coming out.
Yeah, the city is.
Yeah.
But interestingly enough, sitting on the commission that I sit on, is that we still have struggles with the Commonwealth
Right.
being on the same page with us. That's a nice way to say
Yeah.
it.
Well, the Department of Corrections is actually training certified peer specialists behind the walls.
Yeah. Well, let me point this out, and maybe this will help the Commonwealth to send more funding. The difference between the professional you said that you remember being trained back in your day, and 2015's certified peer specialist running the group is this: if I'm facilitating a group of 15 individuals in that group, and I notice that there's an individual who has been consistently coming to this group and who has now been missing for a day or two,
You go after.
and one of these peers tell me, hey, he's in Kensington and Somerset, and by the way, this is a true story. He's in Kensington and Somerset, and he's in this abandoned house, and this is the address. I will guarantee you that me and a coworker of mine will go out to that place and forget the bed bugs, forget the people, forget everything. I'm coming in there and I'm going to find out, what do we need to get this guy back? Does that mean I need to first take him to 1701 West Lehigh so he can take a shower? Do I need to take him to Circle Trip so he can get some clothes so he can feel good about his appearance, build up his self-esteem? Whatever it takes to get this guy back on the road to recovery, I'll make that happen for him. And the individual that I use as an example, as a result of that, today he has, he has an apartment. He just got married. He's working. He's a personal bodybuilder. So I mean, I'm willing to go out there and get them back.
Well, you know what's reinforcing about that thought is that it is a part of the therapeutic process that has been ignored for years and years and years. And now there is a whole cadre of people who are making that connection between the office and the life, as opposed to just hearing about the life in the office.
Yeah.
And actually, that's just part of outreach.
Yes.
Yeah.
That's part of outreach, so that's very important to keep people engaged. If they miss, we need to go out and,
Absolutely.
in some fashion to try to pull them back in.
I as a lead recovery coach, I supervise 7 other recovery coaches, and I'll tell you what, when other people are getting in the office and getting their coffee together, we're already on the street. So we come in at 8:30 in the morning, and by 8:45 in the morning, we're already out on the street. And if that means that we also need to work a Saturday to engage someone, or Sunday to attend church services with somebody, we're willing to do it. Whatever it takes to save someone's life, we're more than willing to do it.
Okay, so now you're out there on the street and you're helping a lot of people, let's just say that, which I totally believe. I mean, I watched it and saw it. I mean, so there has to be a point, just like there is a point in my professional training, where I say, I know what I can do and what I can't do. And, you know, it's a little bit like the Serenity Prayer, if you're familiar with it, you know what you can and cannot do. And so what is it that you believe you hit the threshold as a certified peer specialist, and you say, now I need to seek other stories? Because you're not expected to be the beginning and the end of the life process. You're in a process of professional activity. So we know where you start. When you're with someone as a peer specialist, when do you say, well, I gotta move this to a different level for a while, even though I'll continue to see the person? Where does that come in your training and experiences?
So for us, we use the critical time intervention model, and that's a model that case managers use with homeless individuals. So there's a pre-CTI phase when we're building that rapport with this might mean they're still in treatment, or we just recently engaged them in the street, and then they move to, as soon as they move out of there, and they move into their apartment, because our program actually helps individuals get into PHA housing, Philadelphia Housing Authority housing. Once they get in there, we engage them for an additional 3 months, which is phase one. At this point, we're getting them connected to food banks. You know, we're showing them how to get those peer support groups. We're connecting them to their case management, their treatment center. Phase two, we're starting to back up a little bit. You know, by this point, they know where their treatment center is at. They know where their peer support is at. They know they're getting reconnected with their family. So then that's another 3 months. So now we're at 6 month mark. And then we move to CTI phase 3. By this point, maybe we're seeing them once every 2 weeks. By this point, you know, they have their family over. They're cooking for their friends. They're spending time with their friends. They're engaged with community activities. You know, they're completing IOP treatment. Of course, by this time, they should be working. In fact, most of them are working at this point. So throughout this point, from the first time that I met with them in the pre-CTI phase, I'm having this conversation with them, and I'm starting discharge planning from the very beginning. Be like, hey, while I would love to stick with you for eternity, we're going to be working together for about 9 months. So it's not a shock. It doesn't become like a traumatic experience for them all the way at the end. From the pre-CTI phase, from the first time that we're engaging and we're getting to build that rapport, we're meeting each other, they know that come 9 months from now, unless, of course, we can make the case that hey, this guy needs additional, you know, may have experience
It's
of
like
relapse,
time-limited
something,
intervention,
yeah. They're getting ready to be discharged at that point. And I can tell you what, this model really works. We know what's expected. We know where we need to be. Everybody's on the same page. And what's really cool about our program, the Homeless to Home program at the Mental Health Association, is we're meeting weekly and discussing this guy's concerns, challenges, and progress. There's myself there. We have a division director, our vice president, June Carson. She's very involved. So, and by the time they get discharged, they're referred to a different program. So I might tag Joan and be like, hey, Joan, what are these guys going on over there? Do you think this guy can benefit off of your program? So when I just discharge them, like, boom, that's it. I'm not going to do to them what the prison system did to me. Here's 2 tokens, good luck.
Yeah.
I'm not doing that. I'm going to make sure these guys are connected before they officially become discharged.
Does that sound familiar to you, Joan?
I have people that I refer to Evan all the
Absolutely.
time that, you know, because of their challenges, their barriers, my role at JFK, I can only do so much. I hit a brick wall. And there was one client in particular that I referred to Evan. Evan was able to get case management for this person, and they're trying to get him housing, whereas I couldn't do that. But I think there has to be a little follow-up. There has to be, like,
Absolutely.
at JFK, they come on the floor and they might start out seeing a therapist once a week and a doctor once a month. And they can meet with, and some of them meet with me either before or after their therapist appointment or doctor's appointment. Then they back them down to, you know, twice a month, then once a month with the therapist. But we always tell them, if you need anything in between, please call. Please call. We want to be there for them, you know. And like we have day programs and stuff at JFK, so they step them down from the day program and then they send them up to us at outpatient mental health, where it's a lesser level of care.
So let me ask one other question about this, because I mean the information's important. So someone starts picking up again, and they're on your caseload or whatever it is, or someone is hearing voices that we thought that they were being managed, or they're not taking their medications. Is part of the peer specialist is that you automatically would work with them, but kind of turn them in, if you know what I mean by that. I don't mean it that way, but I mean,
That happens all the time.
there's an expectation that if you're not in the program, I don't mean the AA or NA program, if you're not in the program of what you're supposed to be doing, that you're not considered by them a snitch or anything like that when you go back and say, you know, Dr. So-and-so, he's not or she's not taking her medication, or she's hearing voices, I don't know what they're telling you, you know, in the sense of, does that happen?
Oh, it happens all the time. I mean, at my agency,
Yeah, I
it
would
does,
think
like
so.
where we have people that they missed their doctor's appointment. They're schizophrenic. They're you know, borderline personality, and they get up, they don't have enough medicine. They get off the medicine. So then a couple days go past, and all the symptoms start coming. They come to the agency, and they're flipping out at security because they need their medication. So they call upstairs, and I get sent downstairs, and then usually, you know, my mental health first aid comes in, and I assess the situation, and usually we take them upstairs and we get them to see the doctor or the therapist, one or the other, and if they need more hospitalization or whatever, then they make that call.
And then do you, just as a part of continuity of care, do you then follow them through the hospital, and then when they turn around,
Yes.
in other words, you're the anchor in and out and out again, am I
Yes,
right?
because they have to
That's
make
what I thought
another,
peer specialist-
once they get discharged from the hospital, we have to give them another follow-up appointment within 7 days.
But in terms of disclosing, you know, early on, a certified peer specialist should be telling their participants that they're part of a team, and
Right.
you know, we have to share that information so that you know
Absolutely.
we can plan your care, so that we can help you improve and move on with your life.
Maybe that's a good way to bring this to a close, because whether you know it or not,
Wow.
it goes fast, I'm
Yes.
telling you. But Ozzy, let me, Anzi, I got it right, I only
You
made
got
a
it
mistake
right.
once.
Absolutely.
If someone wanted to get in touch with your agency, could you at least let them know how? So if there's people in their family that they need the support services that you're talking about, that we're talking about.
Okay, well, absolutely. Well, you know, my program, we do have some direct services, but that's not my department. Evan could
Okay.
give you that information. But if a person wanted training, in terms of certified peer specialist, forensic, wedding recovery action plans, supervisor, and those type things, they can just contact the Mental Health Association.
And how about for support? Where would they?
Absolutely. They can actually, all referrals come to me. So they can either email me at efigueroa-vargas@mhasp.org, or the easier way would probably be to give me a call on my direct work cell phone at 267-971-1437.
Well, that's all the time we have for today. I would like to thank my co-host, Anzi Travis, and my two very special guests, Evan and Joan, for being here. Finally, I also like to thank you, the viewers, for tuning in. You have been watching The Tapestry of Life on CCP TV, the Emmy-nominated educational channel of Community College of Philadelphia. I am Dr. Pascal Scholes, Professor of Behavioral Health and Human Services. See you soon.